So do you accept that there are a small cohort of people that, assisted dying actually should be a choice?
Do you want me to answer?
Yeah.
Can I throw a question back? Do you accept there will be a proportion of incorrect deaths if this legislation is...
I've asked you the question.
So yes, there are a proportion of deaths which are less desirable. Now let's break them down. The proportion of deaths which I think are undesirable, a bad death, if you will, people mean different things. One of them is they mean terminal agitation. They're agitated in life. The problem is we can't predict that. There isn't really a way to predict it. So by definition, if you do a preemptive thing, pre-terminal agitation, you'll be killing people, essentially, or allowing assisted suicide to people who then don't have agitation. If you're talking about a bad death in terms of perception, some people will never perceive a death as a good thing because it's death. So there's perception across the thing, and some families never. A third thing would be in terms of, I've caught myself in my head.
Dr. Dorr, you must have seen people in severe pain,
And you know who it is? It is young people with young families who want to live. It is not people who would access this legislation. So going back to Max Watson's point, it is who is this legislation for? This will not solve that problem because you're preempting something we cannot predict. You're basing it on fear of something.
Dr. I'm sure you have given somebody a diagnosis where they just don't want to, obviously a terminal diagnosis where it's life-limiting. I'm sure you've solved on it. I'm sure that's just part of,
and the research shows that if you have a terminal diagnosis, there's a sort of 2-year period where you return to the baseline psychological level you were before. So giving someone a terminal diagnosis, and you're right, suicide increases the year after a terminal diagnosis has happened. So what are we doing there? What are we facilitating? If we're doing that, we're not facilitating choice.
I think we are.